Hello, you must be Miss Lori.
I am.
It is an absolute pleasure to meet you. I'm
Nice
Dr.
to meet you.
Jose. Welcome to our office. All right, Lori, I see quite a few things going on here. How can we help you?
Well, back in June I fell, and since then I've been having extreme low back pain and SI joint pain, sciatica pain, as well as the neck pain. I haven't been able to exercise,
Really?
just go on my daily activities without feeling this pain.
Let's focus on the fall in June.
Okay.
How'd you fall exactly? Right on your left hip, where
Yep.
that problem is?
Yep, right on my left hip.
Do you mind if I feel that area real quick?
Of course.
So you're gonna stay sitting. Wow, that hurts right there, doesn't it?
Yeah.
And does that hurt right there in the glute too?
Yep.
Yeah. Has it started going down your leg yet?
A little bit. Yeah.
Yeah.
Mm-hmm.
Do you feel it go to the knee or all the way down to the foot?
Sometimes all the way down to the foot.
I can definitely see why you're struggling with that. Those muscles are really tight and it's really tender in that area. Let me get this down here. Now you said it's starting to affect the way that your ability to exercise as well,
Mm-hmm.
right?
Yeah.
How long have you been noticing problems with that?
For quite a few years actually, but since my fall, it's been almost impossible to
Really?
exercise. Yeah.
How often were you used to going?
3 to 5 times a week I was working out.
And how often do you go now?
Maybe once if I can stand that.
One time a week? How's that affecting you going from 3 to 5 times being so active down to 1 time a week?
It's been very hard mentally, and that's my stress release, so I've had a lot of stress from it. And
What has life been like since you've had more stress then?
Not great. It's been
Not great in what aspect?
like mentally, it's hard to focus on my daily task. With my work, I can't do the best to my ability with the pain I feel throughout the day.
What about when you get home from work? Do you have kids?
I do.
So are you able to enjoy your time with them?
Not much, no. Not without that pain.
I'm sorry to hear that. This is a big problem for you, isn't it?
Mm-hmm.
I want you to know I'm not going to take this lightly for you, Lori. You know, the last thing I would want to lose is time with my children, so I want to make sure that you're able to do these things and make sure that we can do something to help you. Now, with the low back pain, it's going to the knee, doesn't reach the foot at all. Let's cover the neck area. How long have you had problems with that?
For quite a while. I mean,
Years?
yeah, I would say so.
Few? And when that's at its worst, what does it keep you from doing?
Keeps me from being able to like look around the right,
Movement?
movement.
It's
I
hard.
guess, yeah, movement's been very hard.
Does that ever creep up your neck and cause you any headaches?
Yeah, often actually. I've been noticing more headaches.
How often would you say?
Sometimes even like once a day.
Once
If
a
not-
day?
Yeah.
Lord, I really don't like hearing that because it's only normal. Did you know it's only normal to get 4 headaches for a whole year?
I did not know that.
And you're meeting the quota within the first half of the week. That's a big deal, right? We definitely need to take a look at that. Is there anything else that it's causing you? Ringing in the ears, problems breathing, trouble with your heart, problems down the arms, tingling down the arms and hands? Anything like that happening?
Yeah, tingling down my arms and my hands.
If that's happening there, in your low back, have you started having any digestive problems or problems going to the bathroom yet?
Yeah, I've noticed it's been harder to use the restroom, or I don't go as often.
You're not as regular, right?
Right.
And let me guess, as this problem has gotten worse, it's gotten more and more difficult to go.
Yeah.
That makes
For
a lot
sure.
of sense to
Mhm.
me. Okay. Well, we have a lot written down here. Any medications you're currently on?
Yeah, they have me on some pain medication,
Mhm. What else have you tried for this problem?
physical therapy. I've been to pain management.
Mm-hmm.
Mm,
How's that worked for you?
I haven't seen any results, so.
No results. And you've done all of that over the last 6 months. Wow. No surgery that you know about?
No,
No.
not yet.
Okay. You know what worries me about people that come in after being on all of these things, the physical therapy, pain medication, pain management, usually they're gonna send you to get an MRI. Have you had that done yet?
Oh yeah,
Yeah.
I've had a few done.
And the problem with that is that if they can see it worsening whatsoever, you're gonna be in line for surgery. Has anyone had a conversation with you about that yet?
Yeah.
Wow. Those surgeries are undoable. You know that, right? It'd be in your best interest to try everything possible before we get to that point. Because I've seen people, I'm being honest, spend upwards of $200,000 trying to fix a problem with all these different things that you laid out here. Okay? So, like I said, I'm not going to take this lightly for you. I want to make sure that we can do some good for you. And with that being said, is there anything else that you'd like to tell me that's going to help me help you?
No, I'm just ready to feel better and hopefully get these problems figured out.
All right. Well then, let me tell you how we're going to approach your condition. We're going to approach just like anybody else that comes in with low back pain with radiation down the leg and upper back pain with tingling into the arms and hands with headaches. The problem is that we don't know exactly how you're built, right? We don't know if there's any kind of arthritis happening, tendon damage, ligament damage, nerve damage as well. Once we get all of these things figured out, we'll be able to tell you if we can or can't help you. That sound fair enough?
Mhm.
All right, you can follow me?